As far as the hospitalizations, it's important to remember that vaccines are not 100% effective in preventing COVID. These mRNA vaccines, the Pfizer and Moderna ones, are very effective, far more effective than vaccines that we get for other things like measles and mumps. But it's not 100%. And if you look at the general population, these little dots are just representing some number of people. The red ones are people that are not vaccinated, and the green ones are people that are vaccinated. If a vaccine's not working, you would expect the same distribution of vaccinated people in those that are hospitalized as you see have in the general population. So if 80% of the population's vaccinated, if you look at people that are hospitalized with COVID, you would expect 80% of them to be vaccinated if it wasn't working. But if a vaccine works, the percentage of the people hospitalized who are vaccinated is going to be less than the percent of people vaccinated in the general population. So these are what we are calling those breakthrough cases, but it doesn't mean that the vaccines don't work. They are working. They're just not 100% effective. And the higher the percent of the population that's vaccinated, the higher the percent of the people who are hospitalized that are vaccinated, you'll see. And I've tried to explain this here. This is from out of Public Health England, and I think they did a very good job of explaining this. And I'd like to just walk through it and then show you a few numbers. If you have 1 million people and 92% of them are fully vaccinated, so that's going to mean that 80% are not fully vaccinated. By fully vaccinated, I mean they're 2 weeks out after that second vaccine, that second Moderna or Pfizer vaccine, or 2 weeks out from the Johnson & Johnson vaccine. So if you have 92% of your population fully vaccinated, you have this 80,000 that are not vaccinated and 920,000 that are fully vaccinated. Now, let's assume there's a 2% chance of getting symptomatic COVID. And we have that here in both sides. And here, though, among the vaccinated people, we have 80% efficacy. Okay, so it's going to prevent 80% of the people from getting COVID if they're vaccinated, which means that 20% or 0.2 are going to come down with COVID. So if you take this 0.02, multiply it times 0.2, and then you multiply that times your 920,000, you're going to end up with 3,680 people that are infected with COVID. Over here, you just multiply this 0.02 times the 80, you end up with 1,600 people infected. And if you look at the percent of the cases, you can see that there's actually a large number of cases who have been vaccinated, but it's lower than that 92%, right? If the vaccine wasn't working, this would be 92%, and it's now dropped down to 70. Now, if you go the next step and look at hospitalizations, let's say there's a 10% chance of being hospitalized if you have COVID. If you go through the calculations down here among non-vaccinated, 160 of them would be admitted to the hospital. But over here, we've got 110 being admitted to the hospital. And it's like, whoa, that's not very different. But look at the numbers up here that you're starting with. This is 40% of the admissions, but 92% were fully vaccinated. So these numbers could look very similar, but it all depends on what percent of the population, your baseline, is actually vaccinated. And I think if people want to download this presentation and just look at this slide and think about what is happening at each step, I think it will make a lot of sense and help clarify, because I think it is confusing when they say, oh, 50% of the people that are hospitalized are vaccinated. Well, what does that mean? You don't know. If 50% of the population they came from were vaccinated, then that's something's really wrong. But if you've got like 95% of the population vaccinated, 50% is not bad. So, you have to look at the whole picture. And here I just did some calculations using similar assumptions as in that previous slide, which was that you have a 2% chance of getting symptomatic COVID, that there's a 10% chance of being hospitalized with COVID if you're symptomatic, and that being fully vaccinated is 80% effective in preventing symptomatic COVID and 70% effective in preventing hospitalization, and 1 million people in the population. So exact same assumptions as that previous slide. Now, what if you have a population where no one's vaccinated? You're going to end up with 20,000 people who have symptomatic COVID based on these assumptions up here, and 2,000 of them are going to be hospitalized. We don't have any vaccinated people, so nobody's contributing numbers here. So you end up with this 20,000 cases, 2,000 hospitalizations. If 40% of the population is vaccinated, you're going to get 12,000 with symptomatic COVID out of the unvaccinated group, 1,200 hospitalized. But see, now here in the vaccinated group, we've got 1,600. That is, it's a large number, but it's a lot less if you look at the total numbers here. The symptomatic COVID is now dropped from 20,000 down to 13,600, and hospitalizations are almost halved by having 30% of the population vaccinated, or 40%. This 40% is close to what South Dakota currently is at. If we were to get that up to 80%, you can see what happens here in the final numbers. Again, we've had this final number of symptomatic COVID by about half, and we've reduced hospitalizations significantly down to about 500 hospitalizations. Now, this is just a simple, straight calculation. And what it doesn't take into account is that at these higher vaccination rates, the chance up here, this 2% chance of getting symptomatic COVID, will actually decrease because of that whole idea of herd immunity. The more the people that are vaccinated, the less likely you're going to have a spread. So this is a simplified version, and these numbers are probably higher than what you would actually see, given that this chance here will decrease. So hopefully that helps make sense. It's something that may require a little time to think about it and go over it in your mind, but hopefully you can see